trauma isn't also just, it's not just what happened to me, but it's also what didn't happen to me. Like I didn't have
Mm.
that support from somebody when I was growing up. Those are a few of the pieces that I've come to see when it comes to addiction, and that it's not a one size fits all.
Hello, everyone. I'm Dr. Shafer, your host of Talks with Dr. Shafer. Thank you so much for joining us. I'm a physician, mom, life coach, musician, publisher, author, and I am passionate about using storytelling as a tool to help you reclaim your story and build your most beautiful future. Today, I am so excited to be joined by Eric Fisher. He is a certified counselor. He specializes in trauma, addiction, depression, and other mental health needs. And he is also the author of a book about recovery from addiction. I'm so glad that he's here today with us to share his story, as well as how he is helping people recover from addiction and trauma through his important work. Eric, thank you so much for joining us.
Dr. Shafer, thank you very much for having me on. Very excited to be here.
Thank you so much. I'm so thrilled that you accepted the invitation to come. I am sure that you're going to share so much informative and inspiring information with our listeners. Tell me to begin with, how did you start this journey to become a counselor?
Well, I took a bachelor's of science in psych when I was at a private Christian university in Tennessee. And then I realized there's not much I can do with just that bachelor's. And psychology was always something that interested me. And counseling was always something that was of interest to me. And so I just took the next step and got a Master of Science in Clinical Mental Health Counseling. And the rest is history. I started to do my internship in lovely Mississippi. Yeah.
That's wonderful. And then you ended up in Canada. So I think there's even more to this tale. There's more meandering. And I also understand you have interned with the FBI in the US.
I have 2 different times, yes.
Yeah, and you've
Yeah.
also lived on several continents. So yet tell us about more about this journey. I think there's more to the story.
Yeah, so I was working in Mississippi after my internship. I was working at a inpatient treatment facility for drugs, alcohol, mental health concerns, and a friend of mine in New Zealand had a spiritual emergency. And
Mm.
so, I told my wife about it. We had just been married 10 months before, and then we decided to really just leave the job, leave our cars, leave our furniture, and go to New Zealand for 15 months. And after that, we came to Canada, and we've been here since I've been here since August of 2014.
It's amazing. And that's interesting too, because I think especially as a practitioner of a profession, it can be challenging to move from the States to Canada if you're not a citizen and to maintain what you need to stay as a resident. Have you faced challenges with that, having been there now for 10 years?
Yeah, it was a ringamarole, yes. Like to actually start in Canada after being out of the country well, out of the work really for 15 months. I was working for like a beekeeper randomly in New Zealand
Oh,
just for a little
interesting.
bit, and we really did a lot of house sitting, pet sitting. Um,
Yeah.
I guess
That's
from a
interesting.
life,
And it really
yeah.
helped you really showed up for your friend.
Yeah, yeah, it was a very amazing spiritual experience to be there for him, for his family, for other families that were part of this church congregation. Did a lot of house church, and I guess for my
Mm.
wife, it was a lot of husband sitting. So, yeah, there was that. And then, yes, coming to Canada, I had to start from the ground up again and really just put my foot out there with a lot of cold queries and get certified, which took a bit of time. And I'm glad that all my coursework and everything worked out where I didn't have to take any more educational courses.
And so, what led you to really focusing on addiction and recovery in your professional journey?
What happened was I was working in an outpatient clinic and I got brought into the head honcho's office, we'll say, and I was told I wasn't billing enough Medicaid. And so, I was given this opportunity by my supportive supervisor. Hey, there's an opening at this. It's called the Chemical Dependency Complex, not the, Center of Disease and Control. Like it was called the CDC.
Mm.
And I was able to do that. I had next to no knowledge about addiction at that point. I didn't even take a course in my master's or bachelor's on addiction.
Wow.
There was
Mhm.
some family history of addiction on one side of my family and some mental health concerns. So there is that personal draw. Yet just seeing the transformations of people, like there is a clear baseline often when it comes to addiction, if it's absence focused at least. Well, I mean, we
Mm.
could see that too with harm reduction as well, where someone doesn't do more than what they would like to. They don't go to that excess.
And how does the FBI internship fit into this journey?
In my master's for counseling, I had the opportunity to be an alternate at the DC headquarters for an internship. I applied. Uh, Backtrack uh, in my, let's see, senior year of university, like undergraduate, I did do an internship at the FBI in Jackson, Tennessee at a residential field office.
Mhm.
And so I would go on rides and I would do what's called bait stamping, and I would just really hang out with the agents that were there. We went dumpster diving for a jacket once that someone apparently threw out after they did a robbery, and yeah, just
Oh,
a lot
no.
of a lot of interesting experiences there. So fast forward 2 years later or so, and I'm able to go to DC because someone wasn't able to go as an alternate. They said, "Here you go, Eric. You have like 2 or 3 weeks to find lodging and go to DC for the summer." I was like, "Great, wonderful." So I had to really find a place to stay and make the
Yeah.
travel arrangements, and that was a lovely opportunity.
Wow,
Yeah.
that's so interesting. How has that experience impacted you as an individual and as a counselor?
Being able to meet people from different walks of life, like different states in the country. Like one lady was from Guam, and so there's just different people that I was able to meet. But also, I was working in the Office of International Operations, the Middle East unit, and so I
Mm,
was able to meet people that worked in the FBI that had different experiences and get out of my shell, get out of my bubble, get out of my normal day to day, and just see that there's so many different perspectives and so many different experiences, and there's more than one way to go about something. So
mm.
just being able to really get out of Tennessee really and come to another part of the country was very eye opening. I mean, I've been to other countries before, but to do that for the summer was a really great opportunity.
That's really interesting. And I would imagine as well, when you are assisting someone in their recovery, trying to guide them through that, having had these experiences where you have a better, broader, more worldly understanding of the human experience. One, it broadens the view, but I think also it allows you to focus in on the things that tie us all together, that unify us, our human needs that have to be met for us to then go on and do the great, wonderful things that are a part of being human, and the things that maybe send us on a trajectory where we are suffering from addiction and we are trying to fill a vacuum for some people, fill that hole. But I know you don't necessarily see it that way. How have you come to understand the premise of the cause for addiction through your work and your experiences dealing with people who are suffering from it?
As far as looking at the premise or the cause for addiction, I see that it's not just for pleasure. It might start out as for pleasure, yet I see
Mm,
there's so much pain, there's so much suffering, there's trauma that's often a part of someone's story a lot of the times. And I mean, I do know that not all trauma causes addiction, and not all people with addiction have trauma. At the same time, though, I've come to see that that is a really big piece, whether it's separation of someone at a young age when their parents divorced, or yeah, an early traumatic experience, or childhood neglect. I mean, trauma isn't also just, it's not just what happened to me, but it's also what didn't happen to me. Like I didn't have
mm.
that support from somebody when I was growing up. Those are a few of the pieces that I've come to see when it comes to addiction, and that it's not a one size fits all. For some people, it is harm reduction. focused, and for some people they need to lay off. They need to have abstinence from mood altering substances, behaviors, or even toxic relationships.
Right, because that can trigger in your mind, and not necessarily in your mind, in your brain neurochemically similar cascades to those substances, right? You're trying to activate certain reward centers in your brain through some of these relationships, even when they hurt.
Even when they hurt. Yes, Dr. Shafer, it's so true.
Yeah.
I did a men's group for those that are in recovery from addiction, and I think it was food, sex, and relationships were the three they had to be watchful for as they went on their early recovery because, like as you said, that cascaded dopamine or that those triggers from maybe a toxic relationship might bring me back to the alcohol
Yeah,
or
exactly.
whatever.
And they're kind of those well-worn paths in our mind, right? Where our thoughts have been, where our neurochemical pathways have gone over and over and over again, right? It's in part why, I've got my cell phone here. It's in part why we even just check our email constantly or check our social, did I get a ding? Did I get a message? Because that's a well-worn path. We know I can get that dopamine. I can get that hit. I can feel better and then I can put it down, but then I'm going to reach for it again. And the more I do it, the more my brain knows like, okay, that's the easy way. That's the easy path. I know what I need to do to get it. And it can be very damaging things, just even the phone, pulling us away from our family, pulling us away from our work, pulling us away from our own life, really getting sucked into these devices. And we also see addiction to very damaging substances like alcohol and drugs. Tell me about how in your work you help people if they are, when they're coming to you, how often are they in full recognition of the challenge of the problem they have with their addiction versus not yet in an acceptance phase of what they're really facing?
When they come to me, they're usually at that place of, okay, there's a concern. I can't give a percentage, however, a good
Yeah.
portion of people know they've broken through that denial phase. Like something has
Mm,
happened, whether it's financial or legal or existential, something within relationships, maybe with a spouse or a partner. So it's
mm,
really tough. It's really tough when they're not there, when there is that denial still, or they're very pre-contemplative. It's maybe they've been brought there by another family member, like I was told to come here. Okay. Yeah. So
mm,
I'll meet them where they're at, and we won't go straight into, how dare you not see this as the problem. It's really
mm.
talking about values and, okay, well, let's look at, is what you're doing in line with your values?
Yeah.
Yeah.
That's really so helpful and impactful to really make it person focused and values focused, right? Because at the end of the day, what matters to that individual is what's going to help you motivate them to make better choices for them. And if it doesn't matter to them, you're not going to have their buy-in. They're not going to do what they need to do to help themselves. So how do you help them get there? How do you help them sort through? Because they may have not even had the opportunity yet in their lifetime to have someone actually ask them what matters to them or even put attention on that.
Yeah, they've been told what they're doing wrong. They've been told you need to get help, all that. And they really haven't been asked, yeah, like, what are you missing? What is the values that you're not, what are being supplanted as far as values? What,
Mm.
like you mentioned the word void a moment ago.
Mm.
What's going on? Is there a void that you're trying to fill with this stuff? Like, where's the pain points at for you?
Mm. Yeah. And how do you find, because I know many people who experience addiction, they may come to a point where they feel very frustrated because they've come to this place where they recognize there's a problem. They come to a place where it's affecting their life, whether it be their finances, their relationships, their work, the things they enjoy doing, their sleep, really important things to them. So they may have come to that realization. and decided to take some steps and then kind of slide back, right? Slide back into
Mhm.
the behaviors that aren't serving them and then feel frustrated and use that as a data point of I can't, right? A backward focused data point instead of a future focused data point.
Yeah. Yeah, we call it an abstinence violation effect if someone's pursuing abstinence,
Mm,
where, I did this and I can't do this. The shame and the guilt's going to overwhelm that person. They're going to feel like they can't move forward. It's not that forward thinking, as you mentioned. There's not that progression in a healthy way. The shame is probably one of the most crippling aspects, whether it's social media or Dilaudid or alcohol or whatever it is when it's addiction.
exactly. Shame. I actually call it, I won't say it fully on the show because I don't do any explicit content on here, but I call it the shame old you know what, because I
I got you. I got your number.
because I really, on my personal recovery, not from addiction to substances, but I think it'll be fair to say addiction to a toxic relationship, addiction to trauma, or addiction to my role as somehow I could fix this, somehow I could perform, I could finally satisfy whatever this need was. I could be what I was, what was desired of me. I could be this perfect, partner, when really that wasn't the metric. That was never the metric. And I was addicted to trying to show my worthiness, right? And that was such a dangerous game, and it was leading to a lot of self destruction and just taking me away from my purpose. How do you help people when they are in these self-destructive modes of falling back into those addictions, falling back into those habits, and they're shaming themselves? And we know that is really that shame old, you know what? It does nothing good for anyone. It is very toxic. It is not helpful in any way, shape, or form. So, how do you, in your work, help people try to disentangle themselves from the culture of shame, which is so prevalent in our lives, and really help them maintain focus on their goals and not waste their energy on shame?
Very important and a very large and challenging question.
Mm,
I would say a big part of it is self compassion,
mm,
and a cousin to self compassion, self love, and learning different ways to cultivate those two. And one of the ways to cultivate self compassion is to start to look at, is my relationship with self criticism actually positive? Like, do I feel like I got to beat myself up?
mm,
That's a piece to look at first and start to challenge that thinking that I need to motivate through self-criticism or guilt or shame.
mm,
And so those are a few of the pieces I would definitely talk with people about, is looking at where's my sense of belonging? You know, where is my support system, my tribe, the people in my boardroom, you know?
mm,
Like, who is the people that I can lean on? Because isolation and shame, they like to dance together like fire
mm,
and gasoline. And so I think that a big part is learning, how do I connect again with myself, other people, and a higher presence, whether that's God, universe, whatever that is to somebody. And we don't have to define what that is. It's bigger than us, but it's got to be something that we can latch on to. So those are a few of the pieces. I, I think with shame, and I've heard shame called spiritual suicide. I think spirituality is a huge piece when it comes to working on shame.
mm,
Other words for shame being like freedom and getting our humanity back.
mm.
How do I find freedom in my life through different expressions?
How do you work with people? Is that something that you do through their expression, finding their joy, finding things to, um, for absence of a better term, fill void with in a different way, in a positive way?
Yes. Yes. And that addiction wants me to think that there's going to be this everlasting void, that I'll never be able to fill. And that's why I fill that with whatever it is.
Mm.
relationships, behavior, substances. So part of it is realizing, you know what, I can find these different things that I can do. And yes, I talk with people about what gives you spark. What did you used to do that maybe you don't
Mm.
do as much anymore? You know, or what have you thought about doing? Not everybody has a passion that they can quickly think, yeah, that's my passion. Why didn't I know that? Sometimes it takes some exploration, and maybe it's something that seems trivial, but it's something that
Mm.
gives them that spark.
That's interesting. Yeah, and you would never trivialize what brings someone joy because my goodness, I think, the older we become and the wiser we become, the more degrees we've achieved and accolades and you have enough money to pay off your house, let's say, you have enough money to buy a safe car, you have as much food as you need, right? If you're in this really privileged state of life where you have everything you need and you take a step back and you think, what brings me joy? I think for many people, it is exactly that. It is these simple things. It is seeing a beautiful sunrise and then seeing it the next day and saying, oh my goodness, how interesting that it's a different color today. Why is that? And finding the joy and the spark in those things and realizing that our happiness and our joy really was within us, but we spent a lot of time focusing on external means to try to capture something that we already had.
Yeah, that external gratification is a huge part of addiction. It's beyond addiction, not just substances or behaviors. It's that ego that wants to latch on and say, yeah, I can't find something internally that gives me that joy and happiness and glee.
Mm.
There was a Carl Rogers quote and you mentioned like the sunset. He's like, when I see like a sunset with like the oranges and the purples and all the different hues, I don't say, oh, I need to put a little bit more orange in that sunset there. And just like with people, can we look at people that way? Can we look at ourselves that way, where I don't have to feel like I have to do these little touch ups and then
Mm.
I'm perfect. And the underside of shame often is this perfection that we try
Mm.
to seek out for ourselves.
Right.
What's the balance
And
between perfection and feeling like I'm a turd that's warmed over, right?
yeah. And it's the interesting part about perfection. I think most of us speak to ourselves in such a way that we would never speak to someone else. We have expectations of ourselves that we would not have of others. So, in working with people with addiction, if you find there are these limiting beliefs and these mindset pitfalls, these sinkholes they keep on falling into that then reinforces habits and behavior that are self-destructive because it just puts them back into that loop. What's a process for helping them stay focused on their goals?
Cognitive behavioral therapy is something that can be used, and yeah, I'm not sure if it's been discussed on the show here before, but yeah, it's just really looking at the stinking thinking. Abraham Tversky had a really good book called Addictive Thinking that's really good. He's pretty
Mm.
fly for a rabbi. He's since passed on, and you would not even know it was written by a rabbi. It's very secular, but
Mm.
it's really just looking at challenging those self-defeating thoughts. As you mentioned, what would I tell a friend in a similar situation? I would probably be a lot more compassionate toward them. Now I need to reflect that on myself. And when it comes to comparisons, and I think it's Brene Brown that talks about it's not, it's inevitable that we're going to make comparisons, but can we catch ourselves and can we
Mm.
start to challenge those comparisons that we have?
Yes.
Yeah, I think perfection for a lot of people, there can be like an addiction involving perfection. And can we can we start to look at what it means to demote ourselves to being a human being? You know,
How freeing would that be?
it'd be super freeing, Doc. Super freeing. Yeah. So it's all about being able to challenge the who, the what, the when, and the where, and trying to not get stuck on the why or the how, because interpretations can often lead to just getting analysis paralysis.
Mm, yeah. bringing it back to the body, to the experience, and kind of out of the part of our brains that we get stuck in.
Yes. Yep.
Tell me about your book, the Martial Arts of Recovery. I want to know why you chose that title. It's fascinating. Self-mastery practices to subdue addiction and achieve mental wellness. Tell me about your book and what you were hoping to achieve with it.
I wanted to give folks the chance to see a way to look at addiction and mental wellness and maybe a little bit of a different vantage point than what they originally see. So it's a very holistic book. I I have a martial arts background, and so I take my experience from two different martial arts, primarily American Kempo in the book, and I give different techniques and strategies and concepts from martial arts and translate that over into addiction recovery and for mental health.
That's really interesting because I think, again, to bring you out of your mind, out of these thoughts that are full of limiting beliefs and emotions and memories, bring you into this moment, having something regimented, learning, okay, learning about martial arts, having that focus might be a welcome distraction to pull your energy away and prove to yourself that your energy not only can be pulled away from these negative thoughts and these habits that you wish to change for your health, for yourself, but can also form new habits that will benefit you and just keep you on the path that you truly want to be on.
Yes, yeah, recovery capital, using energy for my own best interest, serving me rather than serving the addiction or depression or anxiety or trauma. A big part with any of those is survival. I'm trying
Mm,
to survive. And people that are in trauma or addiction or whatever, we're all trying to survive. Addiction, however, it's specific because the substance becomes the way of survival in the brain.
mm,
It's like eat, kill, sex, yet
mm.
above those, drug equals survival. And so my hope is with the book that the energy with survival equaling the drug starts to become energy for these different techniques and way of living that's more holistic, refined, healthy, productive, efficient.
That's wonderful. What a wonderful resource for people. So, in your practice, you have mentioned that you perform EMDR and you also mentioned accelerated resolution therapy, that you're a master practitioner of that. Tell us what that is and how you utilize that.
I'll tell you, Dr. Shafer, if you asked me 2.5, 3 years ago if trauma was going to be one of my specialties, I would have said there is no way, not a snowball's chance in Hades. I mean, it was it was not something that I thought I could work with people well on. I didn't have the specialized training.
Mm,
Yet we look at these years later, and accelerated resolution therapy has been a game changer, as has EMDR. I find myself
mm,
using ART a lot more. I'll abbreviate it just to that. It changes negative images to positive images in the brain. So the tagline of the
mm,
therapy is keep the knowledge but lose the pain. So
mm,
I don't forget maybe the traumatic memory that occurred, yet I'm putting something in front of that memory so when I look back, that's what pops up more. I'll give you a case example. So a woman that I worked with was sexually assaulted, and during the session, what she put in front of that actual memory was kicking the guy between the legs, pushing him into a TV, and then
mm,
getting in his race car and driving away. And now that's what she has. That's more empowering and relieving,
mm.
and the pain is left.
And how do you help someone? Do these need to be true memories, things that happened during the
Yes,
incident, or can they be a reconstruction from the patient's perspective?
I usually will say if it's reconstructed and it's true for them, then we'll work on that. If
Mm,
it gives pain, there is a danger with me saying, "Oh, are you sure this didn't happen or did this happen?" I never do that,
right,
because then that's going to be like inception, you know. So I
right.
try to stay away from that. But yeah, it could be an actual memory. Oftentimes it's a composite. It's not. It's like images no traumatic memory is perfectly seamless. That's
Right.
why it's a traumatic memory. It's kind of like having
Exactly.
like frozen in time, different images.
Mm.
So it's whatever comes up for them during the ART procedure. It's called a procedure. It sounds like I'm a surgeon, but I mean, I'm not. I'm not a doctor like yourself. It is surgical. There's a script, and we stay to the script, and we don't usually
Mm.
deviate from it.
Mm-hmm. That was interesting, but I think that I don't want to put one above the other at all, because I really, we need surgery in our life only a few times. And it's really important that the
Mm,
surgeon is exquisitely skilled and practiced. We know that the number one determination for whether or not you'll have a successful surgery is how many surgeries your doctor has done, right? How well that they have practiced that. And you're only going to need that, hopefully, once, twice, three times in your life. You'll need an expert to do that. But we need to be able to cope with traumatic events, because we all experience something. We all experience challenges. We all need to know how to
mm,
do this. And I find, in my experience talking to people, and the beautiful opportunity I have to connect with people, is that so many people have never been gifted the knowledge of how to cope with trauma, of how to cope with these negative emotions. They have so much shame around them and blame towards themselves for even feeling negative emotions, that they haven't gone through those pathways of figuring out, I have these memories, I have these emotions. How do I develop a plan when I'm not in crisis mode, when I'm not triggered, so that I know how I'm going to interact with the experience of that pain?
yeah. And are you asking me what that looks like, or
Yeah.
yeah?
So for you, how have you experienced that? Have you experienced that people don't necessarily come with a good language behind their pain?
Oh yeah, yeah. It's hard to put the words to what they've been through. And trauma lives in the body, and so they do know what's in the body. So often it'll be asked, like, where do you, kind of like some Peter Levine work, like, where do you sense this happening in your body? Some somatic experiencing. For a lot of people, it's the gut. Um,
Mm,
and so a big part of therapy is really, this kind of goes into ADHD work too. It's movement. It's getting in touch with my body, activating what's called the insula a lot more, because the insula is often mm, deactivated or suppressed of trauma.
mm,
Feeling into my body, a more felt sense of my body, is a really big part of the trauma work. So, but yeah, it's hard for a lot of people to put words to what they've been through. And ART, and also EMDR as well, it allows someone non-verbally to work through that in a somatic way.
mm-hmm. Yeah, absolutely. And bring it to your body. Get
Mm,
out of those well worn tracks and these limiting beliefs and these ideas we have about these memories, and instead say, yeah, we have that shame. We have this traumatic event, and we've created this narrative about ourselves, blaming ourselves, shaming ourselves, and just setting that aside and saying, how do you feel? Let's leave all that language and emotion aside, those old emotions of shame and blame. How do you feel in this moment? How do you feel
mhm,
when you imagine being back in that place? And how can we process that? And how can we, like you were talking about working with people too, how can we kind of put an image there that we can focus on, that's going to allow us to cope and to focus differently and be more forward thinking, instead of being kind of stuck in this place that we don't want to be and getting pulled
mm,
back there over and over again.
mhm. And ART allows someone to get unstuck and allows them to progress forward so they can feel what they're feeling in the present moment. It's like taking a bullet out of a wound so they can
Mm,
heal. Um,
yeah. And I love that. And getting back to the discussion about, a medical doctor, a surgeon versus someone who is a counselor, a therapist. I mean, I just think if everyone could have access, especially in young life, to, the gift of understanding the language of emotion, of how our bodies work, of how we can recognize what those signals from our nervous system are trying to tell us in our body, and kind of tune out the excuses that we make for those signals. Instead, just pay attention to them and say, hey, this is wisdom from, the historic part of my brain that's been around a lot longer than I have. I'm going to listen to it, and I'm going to act upon it and respect that my brain is telling me I feel unsafe and I need to investigate that and choose my safety. I need to investigate, and that can go from anywhere from our response to trauma and toxic relationships to, again, the choices we make about substances that are unhealthy for us, and why we're doing that, and how can we change those habits and choose to prioritize ourselves.
Yes. Prioritizing the self when it comes to trauma or anything is of the utmost importance. And that's what's unfortunately left on the wayside. And I believe you did. I think what you were talking about just a moment ago was curiosity. Can I get curious? Can I have this beginner's mind where I'm seeing things
Mm,
maybe as fresh for the first time? Like maybe I'm not an expert on this. I have to watch out for that with my work, not to be not in the expert chair. I need to have a beginner's
mm,
mind with anybody that I come across. And it's the same when people are working on trauma. They're getting curious with their body, with their mind, their heart's telling them what they see around themselves in the environment. So I think what you mentioned there, with prioritizing curiosity, is it often a barrier with trauma? It can be, because I don't want to get curious because I'm scared about what I'm going to find in my body. Little by little, with a supportive person.
I love it. And I can't think of a more supportive person to help someone who's coping with their trauma, who is on the road to recovery, than someone like yourself. And I so appreciate the work you're doing, not only at your counseling office, which is Recovery Arts Counseling in
Yes.
Calgary.
Yeah.
Yes. But also through your book, and through coming on podcasts like mine and gifting your time and your knowledge and just your healing presence to us. I so appreciate that.
Well, thank you very much, Dr. Shaver. It's been a blessing to be on today. And you know, a lot of doctors that I've come across, they have this a certain mindset, if you will. And it's hard to find the doctors like yourself that are willing to maybe not think that they know everything. you know, it takes a certain amount of humility that with someone that's been through so much experience and training. And I have to remember that too. Like I mentioned a moment ago, I have to know that there's always something to learn. No contemplation or no contempt prior to investigation.
Mm, that's beautiful. And anything that disconnects us, that raises us above or lowers us beneath, any of these thoughts or kind of egotistical mechanisms we have to delineate, where we belong in a hierarchy, is disconnecting. It's not connecting. And I love you really focusing on that experience because, we like to say in medicine, the patient is the expert in themselves.
Mm.
They are. And it sounds like, that is your approach as well. But we also have professional gifts and tools to gift them, but to respect them and understand their autonomy, and that they're going to choose how and when to utilize those gifts. And they're better able to do so if we really help them investigate their why. And then once we know why, we reach for tools. If we don't know why we need that tool or what it can potentially do for us, why would we?
Yeah, if I don't know that it's addiction or trauma or depression or whatever it is, and even the subtleties of those, why would I go in a certain direction if I don't know?
Right. So it's a
Yeah.
beautiful partnership that you have with patients to help them move forward in their recovery and work on mindset, work on coping skills. How can people learn more about you and the work you do? Where can they go to find out more information?
Recovery Arts Counseling, just putting that in on Instagram. That's 2 L's since I'm here in Canada. Uh, Same thing, the website, recoveryartscounseling.com. Facebook, same thing. LinkedIn as well. So those are a few of the places that people can find me.
Excellent. Well, thank you so much again for bringing your healing presence to the show, Talks with Dr. Shafer. It's been so lovely to have you. And thank you to our listeners for being here as well. If you have any questions or comments, please do leave them below. Feel free to reach out on my website, www.drshaferstejanova.com. I'm happy to answer those. And again, thank you so much to Eric Fisher, and check out his book. I'm going to read it again because I think it could be a wonderful resource for anyone. The Martial Arts of Recovery Self-Mastery Practices to Subdue Addiction and Achieve Mental Wellness. And I do wish everyone to have a safe and wonderful day. Take care, and I'll talk to you soon.